Segment sponsored by Dr. Stuart Leicht.
Welcome to another edition of Meet Your Provider. Today we are talking about some of your options when it comes to skin cancer treatment. We are once again joined by Dr. Stuart Leicht along with Kelly Jones here in the Boones Creek community of Johnson City. Thanks so much for having us out today.
Thanks for having us.
We talked a little bit about this on our last edition of Meet Your Provider, skin cancer treatments. And of course, when it comes to skin cancer, so many people affected here in the Tri-Cities area.
It's true. We're very excited that we have an alternative to surgical treatment here for certain patients with selected skin cancers, which is image-guided superficial radiation therapy with gentle cure. This provides a good option for patients that are tired of getting cut on, frightened of getting surgery done, and it's actually, I think, a superior method for tumors in certain areas like eyelids, mouth, nose, scalp, and legs. This is a methodology of doing treatment that doesn't require excision at all, so there's no wound involved with it. It's painless. It provides an excellent cosmetic result with little or no scarring. There's no risk of bleeding, no pain, no risk of infection with it. We're very proud to offer the gentle cure option here. Again, it provides an alternative methodology for doing that. In a way, I think there's a lot of misconception about it. Many patients are familiar with Mohs surgeries. In a way, what we're doing is Mohs radiation therapy, where we use imaging to see the extent and the depth of the tumor at the front end, where the Mohs surgeons essentially visualize that and recreate it at the back end. So the cure rate is the equivalent of Mohs surgery, which is the gold standard. We have a 99% plus cure rate doing this. So it's a very good option for patients that, for whatever reason, don't want to undergo surgery.
Yeah, you mentioned like your face area and things like that because you said image guided. We know exactly where we're going. We're able to watch that, track that.
Exactly. We can watch the tumor shrink up and we confirm that it disappears at the end of that. Additionally, there are complications in certain areas like eyelid, the nose, and the eyelid may require oculoplastic reconstruction after things are excised. The nose and lip can have distortion no matter what you do. On the tip of the nose, there may be, even if it's closed perfectly, there may be airflow abnormalities that can be very irritating and annoying later on. These are what we call free margins. And I think clearly radiation therapy, image-guided radiation therapy, is superior to surgery in these areas, again, because there is virtually no scarring, no distortion of tissue. There are all advantages and really no disadvantages with that.
And Kelly, you're a radiation therapist, so you work kind of one-on-one with those patients. What are you hearing from your patients who are undergoing this type of treatment?
Everybody is very happy with it. They come in and they're so thankful that they were given the option to do this. They're amazed that there's no scarring. There's light redness usually, but they are all very happy and they enjoy coming. They like to come to this office, and the treatments are 5 minutes at the most, in and out the door. And they love it. They're very, very pleased with the outcome.
So it's a series of treatments, correct?
Yeah, there are advantages and disadvantages of any particular approach to take with skin cancer. With surgery or Mohs surgery, it's a one-off procedure, so it's one and done and it's over with. It's cost effective, it has a high cure rate, but there are negatives to it.
Right.
There's the pain of the excision, pain afterwards, there's the necessity of aftercare, there's risk of bleeding, infection, scarring. That's all avoided with this. There are two inconveniences, I suppose, as you could put it, with the gentle cure treatment. One is that there may be a deductible, which may be significant depending on the patient's insurance. And the second thing, it is inconvenient. It requires 20 treatments or 20 visits here. However, each visit is generally only about 5 minutes. It's in and out, and we schedule it pretty much with complete flexibility as to the days of the week and the time of the day that it can be done. So we try to work around the patient's schedule with that.
Well, certainly a lot of information. We're going to give our viewers the website if you would like to learn more. Of course, that's drstuartleichtderm.com, that website right there on your screen, so you can learn more. And the office is located right here in the Boones Creek community of Johnson City.
The preceding segment sponsored by Dr. Stuart Leicht.